Hey everyone, welcome back to the channel. Today we're diving into Olumiant, also known as Baricitinib. It's a JAK inhibitor that's been making headlines in autoimmune and inflammatory disease treatment. Whether you're a healthcare provider or someone just doing your own research, you're in the right place. So what exactly is Olumiant? It's an oral medication from Eli Lilly, approved for a few key conditions. That includes moderate to severe rheumatoid arthritis, severe cases of alopecia areata, and even COVID-19 in hospitalized adults who need oxygen or a ventilator. The way it works is pretty fascinating. It blocks enzymes called JAK1 and JAK2, key players in the immune signaling process. By doing that, it turns down the volume on inflammatory cytokines like IL-6 and interferons. In other words, it helps calm an overactive immune system. Here's how JAK inhibitors like Baricitinib actually work. Think of JAKs as messengers inside your cells. When an immune signal lands on a receptor, JAKs fire up and trigger inflammation. Baricitinib blocks that signal, which can help control autoimmune flare-ups. Now for dosing. For rheumatoid arthritis, most people start at 2 mg once a day. If there's not enough response, it can go up to 4 mg. In alopecia areata, either 2 or 4 mg daily is used based on severity. And when it comes to COVID-19, it's a short-term treatment, often combined with remdesivir or steroids in the hospital setting. What about lupus? Well, Olumiant showed some promise early on. In a phase 2 trial, the 4 mg dose improved joint and skin symptoms in lupus patients. That led to 2 big phase 3 trials, SLE-BRAVE I and II. SLE-BRAVE I actually met its primary endpoint using the SRI-4 score, but SLE-BRAVE II didn't hit the mark. And since neither trial showed consistent results across secondary outcomes, Eli Lilly decided to halt lupus development in 2022. A real disappointment for the lupus community. Now let's talk safety. Common side effects include things like upper respiratory infections, nausea, and headaches. But there are some serious risks too. Baricitinib carries a boxed warning for blood clots, serious infections, and certain cancers. That's why patients need lab monitoring, CBCs, liver function tests, and screenings for TB and hepatitis before starting treatment. So, a few clinical pearls to keep in mind. 1. Olumiant is a solid oral option for RA patients who don't respond to TNF inhibitors. 2. It's a breakthrough treatment for severe alopecia areata. 3. It's not an approved option for lupus, despite early buzz. And 4. Always assess infection risk and clotting history before prescribing. Bottom line, Olumiant is part of a new generation of targeted synthetic DMARDs. It's powerful, flexible, and offers an alternative to injectable biologics. But like all strong meds, it needs thoughtful use, monitoring, and the right patient selection. If you found this video helpful, give it a like, hit subscribe, and share your thoughts or questions about Olumiant in the comments. Want us to cover JAK inhibitors versus biologics in a future video? Let us know. Thanks for watching and see you next time.